Well, first of all, let me say how happy I am to meet you. This is my first year on this subcommittee, and I know that OMB faces many challenges ahead, so I look forward to working with you on many of these challenges. One I wanted to just reference is the rise in unemployment rate, as well as the harsh reality of living in poverty. National rate now is about 9%. In my own state, I come from California, it's a little over 11%. Money that was invested in the economic recovery package, hopefully will spur the growth of a green, energy independent economy and will save countless jobs and create countless more. But many economists are projecting now that over 10 million more Americans will fall into poverty due to this recession. And so I'm wondering if OMB has looked at poverty rates per se and looking at policies, programs, and initiatives on behalf of the President to kind of make some suggestions on what we need to do to keep families out of poverty and those living in poverty to help lift them out of poverty. That's the first part of my question. The second part is last year we passed and it was signed into law the legislation that repealed the international HIV travel ban. I believe OMB is responsible for reviewing the rule that HHS has put together. I think, if my information is correct, that was submitted to OMB April 20th of this year. So I'd just like an update on this rule and if there are any specific issues that OMB may have with regard to this, any budget-related issues, and how long do you think this is going to take? Because we passed this last year. It was signed into law by President Bush in our Global HIV/AIDS Initiative, and it's really time to lift this travel ban and to move on. And so I'm wondering about the bureaucracy and all of this and what your time frame is on it. Thank you again.
Okay, let me deal with that second question first. I need to be careful not to comment on things that are in the middle of the regulatory review process, but I'm sure we can get back to you in writing with a date for a timetable for when the next steps will occur. With regard to unemployment and poverty, I guess I would say several things. First, one of the reasons that the President has put forward and embodied in the Recovery Act we have a progressive change in the tax system is, in terms of immediate impact, that along with strengthened unemployment insurance benefits and other things provides the most immediate relief to households. So, for example, the Making Work Pay tax credit, which is refundable, American Opportunity Tax Credit for higher education, which is also has refundability components, provides relief to low and moderate income families. Beyond that, and as you sort of get out of immediate relief and into the not just providing the fish, but learning how to fish, education and health are absolutely essential, and that's one of the reasons why the administration is focused so much on improving our educational system, not only in early childhood, but throughout the process, and trying to get more college enrollment and more college graduation through an expanded Pell Grant program, through simplifying the application form for Pell Grants, which are too complicated right now, through reorienting the Perkins Loan Program, through a college access and completion fund that we are trying to create. And then finally, one of the things that I think has not received enough attention, we talk a lot about income inequality in the United States. The growing gap in life expectancy inequality has received very little attention. Most people know that life expectancy is going up. Many people know that better educated, higher income people live longer than less educated, lower income people. The fact that that gap between better educated, higher income people and less educated, lower income people is literally exploding in life expectancy, I don't think has received as much attention. One of the motivations, it's not the only one, but one of the motivations for reforming the healthcare system, not only to reduce costs but expand coverage, is to get at that growing gap.
Yeah, thank you very much. And let me just add to that. Within that growing gap, though, you're looking at a large percentage of that growing gap being with communities of color in the African American, Latino, and Asian Pacific American community. Part of the healthcare reform debate has got to include healthcare, closing those healthcare disparities. And I just want to say, for the record, Mr. Chairman, the Tri-Caucus, the Black, Hispanic, and Asian Pacific American caucus, have been trying to communicate what you just said. to those that are beginning to write this health bill, so that we can have a provision in the health care reform bill that really addresses this widening gap in disparities. And a large percentage, as I said, are based on race and ethnicity. Thank you very much.
I thank the gentlewoman from California, and I just want to piggyback on that statement. I think any health care approach that we take has to deal with the disparity. I mean, that studies have taken place all over this country, and it just goes right along. It's not just housing, it's not in jobs, it's how much people make, but it's in the health care delivery and what people get in return within that system. And so if we are truly going to deal with health care, we have to make sure that the middle class gets protected, absolutely, and we have to deal with the disparities in the system.
Absolutely. And by the way, one other aspect of this is not just healthcare, but there are other aspects of health behavior that influence that life expectancy gap, for example. One of the things that I think we are hoping for in, just as an example, in school nutrition reauthorization is to move the system towards providing healthier meals to kids so that you're on a better path, even apart from the healthcare system.